Ability grouping refers to the practice of organizing students into different classrooms or groups based on their perceived ability or achievement level. This practice has been utilized in various educational settings, from primary school to college, and has been a topic of debate among educators, researchers, and policymakers for decades. One potential benefit of ability grouping is that it allows teachers to tailor instruction to the specific needs of each group. Students who are placed in high-ability groups may receive more challenging material and faster-paced instruction, while students in lower ability groups may receive more individualized attention and instruction that is more geared toward their skill level. Proponents of ability grouping argue that it can help promote academic achievement by providing students with appropriate instruction and classroom experiences that match their abilities. In addition, it is believed that ability grouping can improve the learning environment by fostering healthy competition, promoting student engagement, and reducing disruptive behavior among students. On the other hand, critics of ability grouping argue that it can reinforce stereotypes and negatively impact the self-esteem and motivation of those students who are placed in lower ability groups. They also contend that it may lead to academic tracking, or the systematic sorting of students into separate groups based on their abilities, which can have long-term negative effects on students' educational and career outcomes. Moreover, ability grouping can exacerbate existing inequalities in education, specifically the opportunity gap between students from different socioeconomic backgrounds. Research has shown that students from low-income families, racial and ethnic minority groups, and other historically marginalized populations may be more likely to be placed in lower ability groups due to systemic biases and other factors beyond their control. In recent years, there has been a movement toward alternative approaches to ability grouping that seek to mitigate these issues. For example, some schools have implemented mixed ability classrooms that incorporate strategies such as cooperative learning and differentiated instruction to provide students with differentiated instruction and collaborative learning experiences. In conclusion, ability grouping is a practice that has both advantages and disadvantages and has been widely debated in educational circles. While it has the potential to provide students with tailored instruction, promote student engagement and reduce disruptive behavior, it may also reinforce stereotypes, negatively impact self-esteem and motivation, and exacerbate existing educational inequalities. As such, it is important for educational professionals to consider both the potential benefits and risks of ability grouping and to seek out alternative approaches that are more inclusive and equitable for all students. Ability level refers to the degree of proficiency or competence exhibited by an individual in a particular skill or area of knowledge. It can be used to describe a person's natural abilities, such as intelligence or physical coordination, or their acquired abilities, such as reading, writing, or problem-solving skills. In educational settings, ability levels are often used to differentiate students based on their academic performance or potential. This can involve placing students into different groups or classes based on their demonstrated ability, or by providing them with targeted instruction and resources based on their individual strengths and weaknesses. One of the primary benefits of identifying and working with different ability levels is that it allows teachers and educators to provide more tailored and effective instruction to their students. For example, a teacher may assign more challenging material to high-ability students, while providing more support and scaffolding to low-ability students to help them catch up. In addition to academic performance, ability level can also be important in other areas of life, such as employment and athletics. For example, job postings may require certain skill sets or abilities, and athletes are often classified by their physical abilities and performance levels. However, it is important to note that ability level is not a fixed or immutable characteristic of an individual. Rather, it can change and evolve over time, influenced by a variety of factors such as practice, experience, and exposure. In addition, ability level is not the sole determinant of success or achievement, as other factors such as motivation, persistence, and resources also play important roles. Moreover, the concept of ability level can also be problematic if not used appropriately. In some cases, it can reinforce stereotypes or biases based on factors such as race, gender, or socioeconomic status. Additionally, ability level classifications can sometimes lead to academic tracking, where students are sorted into different tracks based on perceived ability, which can limit their educational opportunities and reinforce existing inequalities. In summary, ability level describes an individual's level of proficiency or competence in a particular area, and is often used to differentiate students for educational purposes. While it can be useful in tailoring instruction to individual needs, it is important to avoid reinforcing biases or limiting potential based solely on perceived ability. The term, ability parameter, refers to a specific characteristic or attribute that is used to assess or measure an individual's abilities or skills in a particular domain or area of expertise. In various fields, such as education, psychology, or employment, ability parameters are often employed to evaluate and compare individuals' capabilities or performance levels. These parameters can take different forms depending on the specific context and the skills being assessed. For example, in the field of education, ability parameters might include reading comprehension, mathematical problem solving, or critical thinking skills. These parameters provide educators with a way to assess and categorize students' abilities, enabling them to design appropriate instructional strategies and interventions. In psychological assessments or research studies, ability parameters can refer to various cognitive abilities, such as memory, attention, spatial reasoning, or verbal fluency. These parameters help psychologists or researchers understand and measure different aspects of human cognition and functioning. In the workplace, ability parameters are often used in job descriptions, performance evaluations, and competency frameworks. They may include skills such as communication, teamwork, adaptability, or technical proficiency, which are considered critical for success in specific roles or industries. It's important to note that ability parameters are not always linear or one-dimensional. They can be multidimensional, and individuals may possess varying levels of proficiency across different parameters. Moreover, ability parameters can be influenced and developed through factors such as training, practice, experience, and personal characteristics. While ability parameters can be helpful tools for assessment and evaluation, it is essential to use them carefully and avoid making sweeping generalizations or judgments based solely on these parameters. They should be considered in conjunction with other factors, such as motivation, personality traits, and contextual factors, to gain a comprehensive understanding of an individual's abilities and potential. Furthermore, it is crucial to recognize that ability parameters are not fixed and can be enhanced or improved with effort and learning opportunities. In summary, an ability parameter refers to a specific characteristic or attribute used to assess individuals' skills and abilities in a particular context or domain. These parameters play a role in educational settings, psychological assessments, and workplace evaluations, but should be used with caution and in conjunction with other factors to gain a more comprehensive understanding of an individual's abilities. An ability test is a type of standardized assessment designed to measure an individual's cognitive or skills-based abilities in a specific area. These tests are commonly used in education, psychology, and employment settings to evaluate an individual's strengths and weaknesses and make informed decisions about their abilities. Ability tests can assess various types of abilities, such as reasoning, perception, memory, spatial awareness, verbal skills, and numerical abilities. The tests can be timed or untimed and often involve multiple-choice questions, open-ended questions, or performance-based tasks. In educational settings, ability tests can help identify learning disabilities or giftedness, tailor instruction, and inform academic placement decisions. In psychology, ability tests can provide insight into an individual's cognitive functioning, identify areas of intervention or support, and inform diagnoses or treatment plans. In employment settings, ability tests are often used as part of the selection process to assess candidates' abilities related to the job, such as problem solving, critical thinking, communication, or technical skills. Ability tests can also be used to evaluate current employees' performance, identify potential for promotion, or identify areas for training or development. Overall, ability tests provide a standardized and objective measure of an individual's abilities, enabling informed decisions about their abilities and potential in a particular domain. However, it's essential to use these tests as one part of a broader assessment process, in conjunction with other factors such as motivation, attitude, or personal characteristics. Additionally, it's crucial for these tests to be administered and interpreted appropriately to ensure fairness, reliability, and validity. An ability trait is a characteristic or quality of an individual that reflects their level of mastery or proficiency in a particular ability or skill. These traits are often identified and evaluated through various types of assessments such as ability tests or performance-based measures. Ability traits can refer to a wide range of skills or abilities, including cognitive abilities like memory, reasoning, or processing speed, or practical skills like organization, communication, or leadership. These traits can differ in terms of their complexity, specificity, and importance for different contexts or roles. For example, in academic settings, ability traits can refer to skills such as critical thinking, writing, or problem solving, which are typically assessed through exams or essays. These traits are important for success in various academic disciplines and are often evaluated as part of the admission or selection process for higher education programs. In employment settings, ability traits might refer to specific technical skills, such as programming languages, medical knowledge, or engineering expertise. These abilities can be assessed through job-specific tests or performance tasks, and often play a critical role in hiring decisions and performance evaluations. Ability traits are not fixed and can be enhanced or improved through education, training, practice, and experience. Additionally, ability traits can be influenced by factors such as motivation, attitude, personality, or contextual factors. It is crucial to consider these factors when assessing an individual's ability traits to gain a comprehensive understanding of their abilities and potential. Ability traits can be evaluated through various types of assessments, with different levels of reliability and validity. Some examples of assessments used to evaluate ability traits include standardized tests, situational judgment tests, or behavioral assessments. Overall, ability traits reflect an individual's proficiency and mastery in specific abilities or skills. These traits play a significant role in various contexts, including education, employment, and personal development, and can be evaluated through various types of assessments. It's essential to use these assessments appropriately, considering the various factors that can influence ability traits, to make informed and fair decisions about individuals' abilities and potential. Ability achievement discrepancy is a term used in the field of education and psychology to describe a situation where an individual's abilities or potential, as measured by ability tests, do not match their actual performance or achievement in a particular area. This discrepancy can have significant implications for the individual's education, personal development, and well-being, and it is often the focus of assessment and intervention. The ability achievement discrepancy is often assessed using standardized tests that measure different aspects of an individual's abilities and skills. For example, ability tests such as IQ tests or cognitive assessments can provide an estimate of a person's intellectual abilities, while achievement tests such as reading or math tests can evaluate their actual performance in these domains. When an ability achievement discrepancy is present, it suggests that the individual is not performing up to their full potential, and there may be underlying factors contributing to this discrepancy. These underlying factors may include learning disabilities, attention deficit hyperactivity disorder, ADHD, emotional or behavioral issues, or environmental factors such as poor teaching or lack of resources. Interventions for ability achievement discrepancies typically involve identifying the underlying factors contributing to the discrepancy and addressing them through appropriate accommodations, modifications, or interventions. For example, an individual with a reading disability may need specialized instruction or assistive technology to improve their reading skills and close the gap between their ability and achievement levels. It is important to note that an ability achievement discrepancy is not always an indicator of a problem or a disability. Some individuals may simply have strengths in areas that are not measured by standard achievement tests, or they may experience external factors such as stress or anxiety that affect their performance. It is essential to consider the individual's strengths and weaknesses, as well as their overall well-being and context, when assessing an ability achievement discrepancy. In conclusion, an ability achievement discrepancy refers to a mismatch between an individual's abilities or potential and their actual performance in a specific area. This discrepancy can have significant implications for the individual's education and personal development, and it often requires assessment and intervention. By identifying and addressing the underlying factors contributing to the discrepancy, it is possible to help individuals reach their full potential and improve their outcomes. Abiotic factors are non-living components of an ecosystem that have a significant impact on the organisms living within it. These factors include elements such as temperature, sunlight, water availability, soil composition, and physical features of the environment. Temperature is one of the most important abiotic factors as it affects the metabolic rates and physiological processes of organisms. Different organisms have different temperature tolerance ranges, and extreme temperatures can be lethal. Sunlight is another critical abiotic factor as it provides energy for photosynthesis in plants and influences the behavior and activity patterns of many animals. Water availability plays a crucial role in determining the distribution of organisms. Some organisms require fresh water, while others thrive in marine or brackish environments. Water availability also affects the growth of plants and can contribute to the development of diverse habitats such as wetlands or deserts. Soil composition and quality are fundamental abiotic factors affecting the growth and survival of plants. Soil pH, nutrient levels, and organic matter content influence the types of plants that can grow in an area. The physical features of the environment, such as topography and elevation, can also impact the availability of sunlight, water, and temperature gradients, thus shaping the composition and distribution of organisms within an ecosystem. Abiotic factors can interact with each other and influence the overall structure and functioning of an ecosystem. For example, temperature and rainfall patterns interact to form different types of biomes like rainforests, grasslands, or tundras. The combination of abiotic factors determines the range of species that can survive in a particular habitat and their adaptations to deal with these conditions. Understanding abiotic factors is crucial for ecosystem management, conservation, and predicting the effects of environmental changes. Climate change, for instance, can alter temperature and precipitation patterns, which may disrupt ecosystems and lead to shifts in species distribution and abundance. In conclusion, abiotic factors are non-living components of an ecosystem that profoundly influence organisms and their interactions within a given environment. These factors include temperature, sunlight, water availability, soil composition, and physical features of the environment. Understanding these abiotic factors is essential for comprehending the dynamics of ecosystems and for effective environmental management and conservation efforts. Abiotrophy is a term used to describe a pathological condition or syndrome that is caused by genetic defects or other non-infectious factors. Abiotrophy refers to premature or accelerated aging within an organism's cells or tissues, resulting in degenerative changes and abnormalities that can lead to the development of various diseases and disorders. Abiotrophy can occur in a wide variety of species, including plants, animals, and humans. The genetic defects that cause abiotrophy can be inherited through the genes of one or both parents or can arise spontaneously due to mutations or environmental factors such as exposure to toxins or radiation. Abiotrophy can manifest in a variety of ways and can affect different parts of the body. For example, in plants, abiotrophy can cause premature leaf drop or fruit loss, while in animals such as dogs, it can cause degenerative changes in the brain and spinal cord, resulting in diseases such as progressive retinal atrophy and cerebellar ataxia. In humans, abiotrophy can cause a range of disorders such as muscular dystrophy, neurodegenerative diseases, and premature aging syndromes. Diagnosis of abiotrophy can be challenging, and affected individuals may not display symptoms until later in life. However, genetic testing and other diagnostic tools can be used to identify individuals with genetic mutations associated with abiotrophy and provide more accurate diagnoses. Currently, there is no cure for abiotrophy, and treatment options for individuals affected by it are limited. However, ongoing research into the genetics of abiotrophy and its underlying mechanisms offers hope for developing new therapies and treatments in the future. In conclusion, abiotrophy is a pathological condition caused by genetic defects or other non-infectious factors that result in premature or accelerated aging within an organism's cells or tissues. Abiotrophy can manifest in different ways and can affect various parts of the body. While there is currently no cure for abiotrophy, ongoing research into its genetics and mechanisms offers hope for developing new treatments and therapies in the future. Ablation refers to the removal or destruction of tissue or abnormal growths through various medical procedures. It is commonly used to treat a range of medical conditions, including cancerous tumors, abnormal uterine bleeding, heart arrhythmias, and certain skin conditions. There are different types of ablation procedures, depending on the location and nature of the tissue being treated. Some common methods include surgical ablation, radiofrequency ablation, laser ablation, cryoablation, and microwave ablation. Surgical ablation involves physically removing the tissue through traditional surgical techniques. This may involve cutting, excising, or suturing the affected area. It is often used for solid tumors, such as those in the breast, lung, or liver. Radiofrequency ablation (RFA) utilizes electromagnetic waves to heat and destroy targeted tissue. A thin needle-like electrode is inserted into the area, and radiofrequency energy is applied, heating the tissue and causing it to break down. RFA is commonly used to treat certain cancers, such as liver, kidney, and lung tumors. Laser ablation employs the use of high-intensity laser beams to destroy or remove tissue. The laser energy is focused on the targeted area, causing the tissue to heat up and vaporize. Laser ablation is frequently used in dermatology for the treatment of skin conditions, such as birthmarks and tattoos. Cryoablation involves freezing the tissue to destroy abnormal cells. During the procedure, a probe is inserted into the area, an extremely cold gas or liquid is circulated through the probe to freeze the tissue. Cryoablation is commonly used in the treatment of certain cancers, such as prostate and kidney tumors. Microwave ablation utilizes electromagnetic waves of microwave energy to heat and destroy targeted tissue. A microwave antenna or probe is inserted into the area, and microwave energy is emitted, causing the tissue to heat up and destroy the abnormal cells. Microwave ablation is commonly used in the treatment of liver, lung, and kidney tumors. Ablation procedures are generally minimally invasive, meaning that they require smaller incisions or access points compared to traditional open surgeries. This often leads to faster recovery times, fewer complications, and less scarring. However, like any medical procedure, ablation does come with some risks and potential side effects. These can include bleeding, infection, damage to surrounding tissues, pain, and allergic reactions to anesthesia or medications used during the procedure. The specific risks and side effects will vary depending on the type of ablation procedure being performed and the individual's overall health. In conclusion, ablation refers to the removal or destruction of tissue or abnormal growths through various medical procedures. It is commonly used to treat a range of medical conditions, and there are different types of ablation procedures available, depending on the location and nature of the tissue being treated. While ablation procedures offer many advantages, they also come with inherent risks and potential side effects. It is essential to discuss the benefits and risks of the specific procedure with a qualified healthcare professional before undergoing any ablation treatment. Ableism is a term that describes discrimination and prejudice against individuals with disabilities. It refers to the social, cultural, and institutional barriers that limit the opportunities and rights of disabled people, thereby reinforcing societal norms that prioritize able-bodied individuals. Ableism can manifest in various ways, including stereotypes, exclusion, lack of accessibility, unequal treatment, and denial of rights and opportunities. Stereotypes and preconceived notions about disabilities contribute to ableism. Disabled individuals may be seen as weak, dependent, broken, or less capable than their able-bodied counterparts. These stereotypes create barriers to social inclusion and prevent disabled individuals from participating fully in society. Another aspect of ableism is exclusion. People with disabilities often face exclusion from activities, employment, education, and public spaces due to physical barriers or discrimination. This exclusion deprives them of equal opportunities and reinforces the notion that they are less valuable or deserving. Lack of accessibility is a significant barrier for disabled individuals. Public spaces, transportation, buildings, and technology often fail to accommodate the needs of people with disabilities, limiting their independence and ability to participate fully in society. This lack of accessibility communicates the message that disabled individuals are not important or valued. Unequal treatment is another manifestation of ableism. Disabled individuals may face discrimination in healthcare, employment, education, and other areas of life. They may be denied reasonable accommodations, subjected to harassment or bullying, and face unequal opportunities for advancement or success, solely based on their disability. Ableism also results in the denial of rights and opportunities for disabled individuals. They may face challenges in accessing healthcare, voting, housing, and other basic rights that are often taken for granted by able-bodied people. Discrimination and ableist attitudes can affect the ability of disabled individuals to exercise their rights and participate fully in society. To combat ableism, there is a need for awareness, education, and advocacy. Raising awareness about ableism helps challenge stereotypes and encourages the recognition of the rights and capabilities of disabled individuals. Education plays a crucial role in promoting inclusivity and understanding. By teaching about disability rights, access, and inclusion from an early age, society can foster a more accepting and equitable culture. Additionally, advocacy plays a vital role in challenging ableism and promoting change. Disabled individuals and their allies can advocate for policies and practices that promote accessibility, inclusion, and equal rights. They can work towards breaking down physical and attitudinal barriers that perpetuate ableism. Ableism is deeply entrenched in society, and dismantling it requires a collective effort. By recognizing and addressing ableism, society can strive towards a more inclusive and equitable future, where all individuals, regardless of ability, can thrive and have equal opportunities. Ablution is a ritual purification process within the Islamic faith. It involves a ritual washing or cleansing of the body, usually performed before prayer or other religious practices. Ablution, also known as wudu, is a physical and spiritual act that helps to prepare oneself for worship and to increase spiritual purity. To perform ablution, one must first intend to do it for the purpose of ritual purity. Next, a person will begin with the washing of their hands, ensuring that the palms and fingers are thoroughly cleaned up to the wrist. The person must then rinse their mouth 3 times and use their right hand to sniff water into their nostrils and then exhale it out. After that, the person must wash their face 3 times, from the forehead to the chin, ensuring that all areas are covered with water. Following that, the person must wash their arms, starting with the right arm first, including the elbow, up to the wrist 3 times. The person must then wipe their head with wet hands and pass the fingers of both hands through their hair and ears. They then proceed to wash their feet, ensuring that water reaches every part of the feet, including between the toes. Before the actual ablution, a person must ensure that there are no impurities in the area where they plan to perform it. Ablution allows one to become spiritually clean, and so it is only appropriate to do it in a clean space. The ritual of ablution is a significant aspect of Islamic worship as it symbolizes the purity of the body, mind, and soul. Ablution is not only a symbolic action but also a reminder of the importance of cleanliness and purity in every aspect of a Muslim's life. It helps to prepare one for prayer, providing a sense of calmness, and promoting a state of spiritual purity. By undertaking ablution, Muslims become mindful of their actions, thoughts, and intentions. In this way, ablution serves as a reminder that faith is not only about actions but also about the purity of the heart and soul. Ablution is, therefore, a crucial practice that keeps one in touch with their spirituality and reminds them of their religious duties. In conclusion, ablution is a vital component of Islamic worship, and it helps to purify one's body, mind, and soul. It is a reminder of the importance of cleanliness and purity in every aspect of a Muslim's life. By performing ablution, Muslims prepare themselves for prayer, and it encourages them to be mindful of their actions, thoughts, and intentions. It is a physical and spiritual act that promotes spiritual purity, reminding them of their religious duties and the importance of devotion to Allah. Abney's effect, also known as the Abney-Koenig effect, is a phenomenon in which the perceived brightness of a color changes based on the spectral composition of the surrounding colors. The effect was first described by English physicist William de Wivellesly Abney in the late 19th century. Abney's effect occurs due to the way that the human visual system processes color information. Our eyes are sensitive to different wavelengths of light, or colors, and the colors that we perceive are a combination of the colors of light that are reflected or emitted by an object. However, the perceived brightness of a color is also affected by the colors surrounding it. For example, if you place a red object on a green background, the red object may appear brighter than it would if it were on a blue background, even if the physical intensity of the light illuminating the object is the same in both cases. This is due to the way that our visual system processes the contrast between the object and its environment. The red object is a relatively long wavelength color compared to the green or blue background. This causes the surface of the green background to become slightly desaturated, appear less vivid than when viewed in isolation, and shift slightly towards the magenta hue, giving the impression of brightness. The Abney effect has practical implications in fields such as photography, printing, and graphic design, where the perceived brightness and contrast of colors are important considerations. Recognizing the Abney effect can help photographers and designers make more informed decisions about color palettes and image composition. In summary, the Abney effect is a perceptual phenomenon in which the perceived brightness of a color depends on the spectral composition of the surrounding colors. This is due to the way that the human visual system processes color and contrast information. Understanding the Abney effect can help us to create visual media that accurately conveys the intended brightness and contrast of different colors. Abnormal is a term used to describe something that deviates from what is considered normal or typical. It is a subjective concept that varies depending on the context in which it is used. In general, abnormal refers to a state or condition that is outside of the expected range of behaviors, characteristics, or functioning. When applied to human behavior or psychological processes, abnormality often refers to patterns of thoughts, emotions, or actions that differ significantly from what is considered typical or healthy. These patterns may cause distress, impairment in daily functioning, or pose a risk to the individual or others. Abnormal psychology is a field that focuses on studying and understanding these atypical behaviors and mental disorders. There are several ways of defining and identifying abnormal behavior. One common approach is the statistical deviation model, which considers behaviors or traits that are statistically infrequent or rare as abnormal. For example, if a behavior or trait is significantly outside of the normal distribution in a population, it may be considered abnormal. Another approach is the social deviation model, which defines abnormality based on societal or cultural norms. Society determines what is considered normal or appropriate behavior, and any behavior that violates these norms may be considered abnormal. However, this approach can be problematic as it may lead to the pathologization of behaviors that are simply different but not necessarily harmful or distressing. The medical model of abnormality views abnormal behaviors and conditions as symptoms of underlying mental disorders or illnesses. It focuses on diagnosing and treating these disorders through interventions such as therapy, medication, or other medical interventions. It is important to note that the concept of abnormality is not without controversy. Definitions and perceptions of abnormality can be influenced by cultural, societal, and historical factors, and what is considered abnormal in one context may be seen as normal or even desirable in another. Additionally, labeling behaviors or individuals as abnormal can carry stigma and may overlook the diversity and complexity of human experiences. In summary, abnormal refers to behaviors, thoughts, emotions, or conditions that deviate from what is considered normal or typical. It can be defined in various ways, including statistical deviation, social deviation, or as symptoms of underlying mental disorders. However, it is important to approach the concept of abnormality with caution, as it can be subjective, influenced by cultural and historical factors, and may carry stigma. Abnormal behavior refers to patterns of thoughts, emotions, and actions that deviate significantly from what is considered typical or socially acceptable. It is a key concept in the field of psychology and is often used to identify and diagnose mental disorders or psychological impairments. Abnormal behavior can manifest in various ways and can be influenced by a range of factors, including genetic predispositions, environmental influences, and psychological or neurological dysfunctions. It is important to note that abnormal behavior is not synonymous with bad or morally wrong behavior, but rather refers to behaviors that are atypical and potentially problematic for an individual's functioning and well-being. There are several criteria used to identify abnormal behavior. One commonly used framework is the Diagnostic and Statistical Manual of Mental Disorders (DSM), which provides guidelines for the diagnosis and classification of mental disorders. The DSM outlines specific criteria for each disorder, including behavioral, cognitive, emotional, and functional impairments that must be present to meet the diagnostic criteria. Abnormal behavior can vary widely, depending on the specific disorder or condition being considered. Some examples of abnormal behaviors include intense and irrational fears or phobias, persistent sadness or hopelessness, excessive worry or anxiety, sudden mood swings, hallucinations or delusions, self-harming behaviors, substance abuse, or compulsive behaviors. There are different perspectives and theories within the field of abnormal psychology that aim to explain the causes and mechanisms behind abnormal behavior. These include biological, psychological, and sociocultural perspectives. The biological perspective emphasizes the role of genetic, neurological, and biochemical factors in influencing abnormal behavior. For example, certain mental disorders may be linked to imbalances in brain chemistry or structural abnormalities in the brain. The psychological perspective focuses on how thoughts, emotions, and early life experiences contribute to abnormal behavior. This perspective considers factors such as personality traits, cognitive processes, upbringing, and traumatic events as potential influences on abnormal behavior. The sociocultural perspective examines how cultural norms, societal expectations, and environmental factors can shape and influence abnormal behavior. Cultural variations in norms and values can impact the definition and expression of abnormal behavior within different societies. Treatment for abnormal behavior typically involves a combination of different approaches, such as psychotherapy, medication, behavioral interventions, and lifestyle modifications. The specific treatment will depend on the nature and severity of the abnormal behavior, as well as the individual's unique circumstances and needs. In conclusion, abnormal behavior refers to patterns of thoughts, emotions, and actions that deviate significantly from what is considered normal or socially acceptable. It is a concept used in the field of psychology to identify and diagnose mental disorders or psychological impairments. Abnormal behavior can stem from a variety of factors and can have a significant impact on an individual's functioning and well-being. Understanding and addressing abnormal behavior often involves a multifaceted approach that considers biological, psychological, and sociocultural factors. Abnormal fixation, also known as fixation or fixated behavior, refers to an excessive and persistent preoccupation or attachment to a particular object, idea, person, or behavior. It is considered a form of abnormal behavior and can be a symptom of various mental disorders or psychological impairments. Fixations can develop for different reasons and can vary in intensity and duration. They can occur in childhood or later in life and can be influenced by various factors, including psychological, emotional, and environmental factors. Some common examples of fixations include 1. Object fixations. This refers to an intense attachment or preoccupation with a specific object or material possession. This fixation can manifest as collecting and hoarding items, obsessively caring for or preserving certain objects, or developing an excessive emotional attachment to them. 2. Idea fixations. This involves an obsessive preoccupation with a particular idea, belief, or concept. Individuals with idea fixations often engage in repetitive and intrusive thinking patterns related to the fixation. This can lead to rigid and inflexible thinking, difficulty considering alternative viewpoints or perspectives, and a strong resistance to change. 3. Person fixations. This refers to an excessive and unhealthy attachment or infatuation with a specific person. Individual fixated on a person may obsessively think about them, idealize them, or even stalk them. This fixation can lead to feelings of possessiveness, jealousy, and an inability to form healthy and balanced relationships. 4. Behavior fixations. This involves being fixated on a particular behavior or action. This can manifest as repetitive behaviors, rituals, or routines that an individual feels compelled to perform. Behavior fixations can also include addictive behaviors, such as excessive gambling, shopping, or drug use, where an individual develops an overwhelming compulsion to engage in the behavior. Fixations can significantly impact an individual's functioning and well-being. They can interfere with daily life, relationships, and overall psychological health. Fixations can be a symptom of various mental disorders, including obsessive-compulsive disorder (OCD), autism spectrum disorder (ASD), borderline personality disorder (BPD), and certain personality disorders. Treatment for abnormal fixation usually involves a comprehensive approach that may include psychotherapy, medication, behavioral interventions, and support from friends and family. The specific treatment plan will depend on the underlying cause and severity of the fixation. In therapy, individuals may work on identifying and challenging irrational beliefs, learning coping skills, and developing alternative ways of thinking and behaving. In conclusion, abnormal fixation refers to an excessive and persistent preoccupation or attachment to a particular object, idea, person, or behavior. It is considered a form of abnormal behavior and can be a symptom of various mental disorders. Fixations can significantly impact an individual's functioning and well-being and usually require comprehensive treatment approaches. Abnormal grief, also known as complicated grief or prolonged grief disorder, is a psychological condition characterized by an intense and prolonged reaction to the loss of a loved one. While grief is a natural and necessary response to loss, abnormal grief goes beyond what is considered a normal grieving process and can significantly impair an individual's daily functioning and emotional well-being. Abnormal grief can manifest in various ways, but some common symptoms include 1. Intense and persistent sadness. Individuals with abnormal grief often experience deep and prolonged feelings of sadness, despair, and emptiness. These emotions may not improve over time and can persist for months or even years after the loss. 2. Preoccupation with the deceased. People with abnormal grief may become excessively preoccupied with thoughts, memories, or reminders of the deceased. They may have difficulty accepting the reality of the loss and may engage in behaviors such as visiting the deceased's grave or constantly talking about them. 3. Avoidance of reminders. On the other hand, some individuals may actively avoid reminders of the deceased. They may avoid places, people, or activities that remind them of their loved one, as it becomes too painful for them to confront these reminders. 4. Difficulty functioning. Abnormal grief can significantly impact an individual's ability to carry out daily activities and responsibilities. They may struggle with maintaining relationships, performing at work or school, or even taking care of themselves physically and emotionally. 5. Feelings of guilt or self-blame. Individuals with abnormal grief may experience intense guilt or self-blame related to the loss. They may feel responsible for the death or hold themselves accountable for not preventing it, leading to a deep sense of shame and self-condemnation. 6. Social withdrawal and isolation. Abnormal grief can lead to social withdrawal and isolation. Individuals may find it challenging to engage with others or find comfort in social interactions. They may feel disconnected from others and may have difficulty seeking or accepting support from friends and family. Abnormal grief can be caused by various factors, including the suddenness of the loss, the nature of the relationship with the deceased, or previous experiences of trauma or loss. Additionally, individuals with a history of mental health disorders, such as depression or anxiety, may be more vulnerable to developing abnormal grief. It is crucial to seek professional help if you or someone you know is experiencing abnormal grief. Treatment for abnormal grief may involve therapy, such as grief counseling or cognitive behavioral therapy (CBT), to help individuals process their emotions, challenge unhelpful thoughts, and develop coping strategies. Medication, such as antidepressants, may also be prescribed in some cases. The grieving process is highly individual, and there is no fixed timeline for recovery. However, if grief symptoms persist and significantly interfere with daily functioning and well-being, it is essential to seek help and support from mental health professionals who can provide guidance and assistance in navigating the complexities of abnormal grief. That is our explanation. Apologies if there were any mistakes or expressions. Please click the like button if it was helpful. Don't forget to subscribe if you want to receive other beneficial information. See you. Thank you.